Welcome to the July 2016 podcast from the Journal of Bone and Joint Surgery. This month, our podcast features abstracts of 5 scientific articles published in the July issues of the journal, as well as a commentary by Dr. Kern Singh, MD, et al. On the article entitled Bone Morphogenetic Protein Use and Cancer Risk Among Patients Undergoing Lumbar Arthrodesis, a case cohort study using the SEER Medicare database. Be sure to check out this month's Current Concepts Review article on Tissue Engineering in Orthopedics by Alexander Tatara and Antonios Mikos. The authors note that tissue engineering strategies are being investigated for a number of challenging musculoskeletal pathologies, including fracture non-union, osteonecrosis, and osteochondral defects. Although clinical studies in which the tissue engineering paradigm has been applied in the treatment of orthopedic diseases are limited in number, examining them can yield important lessons. In this review, the authors provide an overview of tissue engineering as relevant to orthopedic surgery. They review how these principles are being applied to treat orthopedic diseases today, with examples from current studies. And they discuss future directions and challenges for continuing to translate tissue engineering strategies from the laboratory to the operating room. In this issue, JBJS.org presents a new image quiz, a 38-year-old man with worsening pain in the lower back. Be sure to visit us online to access these features, as well as the full text of the scientific articles you are about to discover in the following podcast. Next, you'll hear the first abstract of 5 that are being presented in this podcast. This abstract is from the article entitled Bone Morphogenetic Protein Use and Cancer Risk Among Patients Undergoing Lumbar Arthrodesis, a case cohort study using the SEER Medicare database by Dr. Daniel C. Beechler and Associates. Investigation performed at the Division of Cancer Epidemiology and Genetics, National Cancer Institute, National Institutes of Health, Bethesda, Maryland. Recombinant bone morphogenetic proteins, BMPs, are growth factors utilized in lumbar arthrodeses. Limited data from randomized trials suggest that BMP may increase cancer risk. The authors sought to evaluate cancer risk and mortality following the use of BMP in lumbar arthrodesis. Within the linked surveillance, epidemiology, and end results program Medicare cohort, the authors conducted a case cohort study of 7,278 individuals who were 65 years of age or older and had undergone a lumbar arthrodesis from 2004 to 2011. Of these patients, 3,627 were individuals in a 5% random subcohort of Medicare enrollees in SEER areas, including 191 who developed cancer, and there were 3,651 individuals outside the subcohort who developed cancer. Weighted Cox proportional hazards regression was used to estimate hazard ratios and 95% confidence intervals for cancer on the basis of exposure to BMP. In the surveillance, epidemiology, and end results program Medicare subcohort, 30.7% of individuals who underwent a lumbar arthrodesis received BMP. BMP was not associated with overall cancer risk in univariate analyses or after adjustment for demographic characteristics, comorbidities, hospital size, history of cancer, and calendar year. Individual cancer types were also not significantly elevated in BMP users compared with non-users. In addition, BMP use was not associated with a new cancer in people who had cancer prior to undergoing lumbar arthrodesis or with mortality after a cancer diagnosis. Conclusions. In a large population of elderly U.S. adults undergoing lumbar arthrodesis, BMP was not associated with cancer risk or mortality. Next, you'll hear a commentary by Dr. Kern Singh on the article entitled Bone Morphogenetic Protein Use and Cancer Risk Among Patients Undergoing Lumbar Arthrodesis, a case cohort study using the SEER Medicare database.
This is Dr. Kern Singh, providing commentary for the July 2016 JBJS podcast. I will be providing commentary on the article entitled Bone Morphogenetic Protein Use and Cancer Risk Among Patients Undergoing Lumbar Arthrodesis, a case cohort study using the SEER Medicare database. The title of my commentary is Bone Morphogenetic Proteins in Lumbar Arthrodesis. What is all the debate about? Controversy continues surrounding the use of recombinant human bone morphogenic proteins, specifically rhBMPs, in spine surgical procedures. At the present time, more than 20 BMPs have been discovered. Of these, the U.S. Food and Drug Administration has only approved the use of one for lumbar arthrodesis, specifically RhBMP2. Since its approval in 2002, the use of RhBMP2 in lumbar spine surgical procedures has varied, oscillating in response to the FDA public health notifications and professional society recommendations. Prior to the 2008 FDA public health notification concerning the safety of BMPs in cervical surgical procedures, greater than 50% of anterior lumbar interbody fusion procedures, 43% of posterior lumbar interbody fusion or transforaminal lumbar interbody fusion procedures, and 30% of posterior lumbar fusion procedures utilized BMPs. In 2010, their use peaked with 45% of lumbar arthrodesis procedures using RhBMP2. Following the 2008 FDA notification, the mean rate of BMP use in lumbar arthrodesis decreased steadily at 1% per month until the end of 2012. In their article, Biesler contributed to the ongoing debate regarding the association between BMPs and subsequent carcinogenesis, cancer-related morbidity, and mortality. The authors performed a well-executed case cohort study utilizing a large patient population from an established national database, analyzing 7,278 patients who were greater than 65 years of age. The authors' results suggested no increased risk of incident malignancy, cancer-related mortality, or recurrent malignancy when BMPs were used in lumbar arthrodeses. Additionally, the authors observed no association between BMPs and cancer among those receiving BMPs as part of the FDA-approved anterior lumbar interbody fusion procedure or among those receiving BMPs off-label. An important strength of the current study lies in the author's data source. Despite the potential biases associated with the use of national databases, the large sample size enabled the authors to perform a well-powered study capable of detecting clinically meaningful associations. Achieving this power is difficult using other administrative datasets or registries. Additionally, the authors studied the association between BMP use and cancer recurrence among those with a medical history of cancer, a sub-cohort analysis that had not previously been conducted. Because of the overall low incident rate of cancer diagnosis following a lumbar arthrodesis, power limitations have been central to the debate. Independent and industry-sponsored studies have often been underpowered, which has increased the risk for type 1 error and has limited the generalizability of results and capacity to extrapolate meaningful conclusions. Despite several strengths associated with large population-based studies, claims-based datasets are not without limitations. In particular, international classification diseases, ninth revision-based systems, are vulnerable to an array of potential biases associated with billing incentives and inaccuracies. Additionally, they have highly variable sensitivity and specificity and have not been shown to agree well with chart abstracted data. In addition to the limitations of administrative studies, the surveillance, epidemiology, and end results Medicare link dataset used by the authors has several independent limitations. First, the dataset has a known tendency for misclassification among Medicare claims regarding cancer diagnoses. Moreover, although the study results are potentially generalizable to the nationwide elderly population, the results cannot be generalized to those younger than 65 years of age. Additionally, the SEER program is limited in coverage to approximately 28% of the U.S. population and includes cancer diagnoses only while a patient is living in a SEER area. As a result, a patient who moves to a different region is lost to follow-up. The study was also limited by its inability to ascertain a dose-related association between BMPs and carcinogenesis because of the lack of dosing data available within the Medicare claims database. Finally, despite a reported maximum follow-up of 8 years, the authors report on a median follow-up of 2.5 years. Whether this time frame is sufficient to evaluate the impact of BMPs on carcinogenesis remains unclear. With conflicting results regarding the association between BMPs and cancer, it is difficult for the spine surgeon to determine whether he or she increases a patient's risk by using these agents. Large population-based studies have suggested that BMPs are not associated with new onset or recurrent carcinogenesis, but some smaller, institutionally based studies have argued the contrary. Until a large, supervised, prospective randomized controlled trial is performed, the debate will likely continue, with BMP use approximating its current rate. Although studies with lower levels of evidence will likely continue to stimulate the debate, they will ultimately fail to provide conclusive evidence. Ultimately, the decision to use BMPs should be made on the basis of sound clinical judgment by the treating physician after a full disclosure of the potential risk to the patient. Informed consent and transparency are essential while this debate continues.
Next, you'll hear the second abstract of 5 that are being presented in this podcast. This abstract is from the article entitled Surgical Technique Trends in Primary ACL Reconstruction from 2007 to 2014 by Dr. Lisa Tybor and Associates. Investigation performed at Surgical Outcomes and Analysis, Kaiser Permanente, San Diego, California. The surgical technique for anterior cruciate ligament ACL reconstruction has evolved as a result of improved understanding of ligament biomechanics, anatomy, device development, and failed reconstructions. Studies on surgical technique preferences have been limited to surgeon surveys, which are subject to selection and recall bias. The purpose of this study was to evaluate ACL reconstruction surgical technique and yearly revision rate trends in a community-based setting. A population-based epidemiological study was conducted using data on primary ACL reconstruction procedures registered in an ACL reconstruction registry from 2007 to 2014. Changes in the incidence rates of different types of femoral tunnel drilling methods, different types of grafts and graft fixation, and revisions were studied. Adjusted incidence rate ratios are provided. Of the 21,686 ACL reconstructions studied, 72.4% were performed by sports medicine fellowship-trained surgeons. The incidence rate of femoral tunnel drilling via a tibial tunnel decreased at an adjusted rate of 26% per year, from 56.4% to 17.6% during the study period. The incidence rate of medial portal drilling increased from 41.3% to 65.1% at an adjusted rate of 11% per year, and the incidence rate of drilling through a lateral approach increased from 2.3% to 17.3% at an adjusted rate of 53% per year. There was no change in the use of hamstring autograft, bone patellar tendon bone autograft, or tibial tendon allograft. Use of first-generation bioabsorbable femoral and tibial fixation decreased for all graft types. For soft tissue grafts, usage of suspensory metal femoral fixation increased 12% to 13% per year. For bone patellar tendon bone autografts, the use of femoral fixation with interference biocomposite screws increased 7% per year. On the tibial side, utilization of biocomposite screws increased for all graft types. No association was found between revision rate and the year of the primary operation. Conclusions. Surgeons changed their femoral tunnel drilling technique over the study period, whereas the incidence rates of specific graft utilization remained stable. There has been a shift away from first-generation bioabsorbable fixation and increasing use of biocomposite fixation across all graft types. Early cumulative revision rates remain stable. Next, you'll hear the third abstract of 5 that are being presented in this podcast. This abstract is from the article entitled Anatomic Investigation of Commonly Used Landmarks for Evaluating Rotation During Forearm Fracture Reduction by Dr. Douglas S. Weinberg and Associates. Investigation performed at University Hospital's Case Medical Center, Case Western Reserve University, and the Cleveland Museum of Natural History, Cleveland, Ohio. Evaluating rotation during open reduction and internal fixation of a forearm fracture is of paramount importance. In challenging cases, surgeons may utilize radiographic relationships between proximal and distal radial and ulnar landmarks to assess rotational position. However, to the author's knowledge, limited anatomic data are available to confirm these relationships. 600 cadaveric radii and ulnae were obtained. Digital representations of the bicipital tuberosity, the radial styloid, the coronoid process, and the ulnar styloid were acquired, and the rotational profiles between respective landmarks were calculated. In order to validate the results and investigate the ability to differentiate rotated osseous positions, each bone was imaged in increments of 10 degrees of rotation, and the profile of each landmark was measured. The radial styloid was at a mean of 158 degrees plus or minus 14 degrees of supination relative to the bicipital tuberosity. The ulnar styloid was at a mean of 185 degrees plus or minus 14 degrees of supination relative to the coronoid process. Imaging of the bones in increments of 10 degrees of rotation supported the relationships above. It was also found that a 1 millimeter difference in profile size corresponded to up to 60 degrees of rotation for the average ulna, compared with 10 degrees for the average radius. Conclusions. The findings suggest that using the bicipital tuberosity and the radial styloid to assess intraoperative rotation of the radius on antero-posterior radiographs may be of limited value. The landmarks were not generally 180 degrees apart. Although the rotational positions of the coronoid process and the ulnar styloid were on average closer to 180 degrees, surgeons should be aware of the wide range of normal anatomy, as well as the inability to judge rotation by as much as 60 degrees, even for an ideal ulna. Next, you'll hear the fourth abstract of 5 that are being presented in this podcast. This abstract is from the article entitled Factors That Determine Supination Strength Following Distal Biceps Repair by Dr. Christopher C. Schmidt and Associates. Investigation performed at the Department of Orthopedic Surgery, University of Pittsburgh Medical Center, Pittsburgh, Pennsylvania, and the Department of Radiology, Allegheny General Hospital, Pittsburgh, Pennsylvania. Supination weakness commonly occurs after a distal biceps repair. The goal of this study was to identify factors that could influence postoperative supination strength through a full arc of forearm rotation. 15 patients were prospectively studied and underwent a biceps repair using a posterior approach. This cohort was compared with a randomized selection of 17 anterior repair subjects. All patients underwent postoperative magnetic resonance imaging, MRI. Quantitative MRI analysis determined the insertion site angle of the tendon and supinator fat content. Supination strength was measured in 3 forearm positions. A multiple linear regression analysis was performed to determine the effect of all factors on supination strength. The anterior group had a significantly higher non-anatomic insertion site angle of the tendon than the control group and the posterior group. The posterior group had significantly greater supinator fat content than both the control group and the anterior group. After repair, the posterior group had significantly greater supination strength than the anterior group. Multiple regression analysis found that an anatomic reinsertion of the ruptured tendon, posterior approach, and limited supinator muscle fat content were significant predictors of the restoration of supination strength in 60 degrees of supination. Conclusions. Future directions for distal biceps tendon repair techniques should focus on restoring an anatomic reattachment site while limiting supinator damage. Next, you'll hear the 5th abstract of 5 that are being presented in this podcast. This abstract is from the article entitled Effect of Hip Reconstructive Surgery on Health-Related Quality of Life of Non-Ambulatory Children with Cerebral Palsy by Dr. Rachel DeFazio and Associates. Investigation performed at Boston Children's Hospital, Boston, Massachusetts. The primary aim of this study was to evaluate the relationship of the migration percentage, a radiographic metric quantifying hip displacement, in children with gross motor function classification system level 4 or 5 cerebral palsy and spastic hip dysplasia to the acetabular index and the health-related quality of life, as measured with the caregiver priorities and child health index of life with disabilities before and after reconstructive hip surgery. In a prospective cohort study, the migration percentage, acetabular index, and CP child scores were analyzed using the Pearson correlation analysis immediately before reconstructive hip surgery and at 6 weeks and 3, 6, 12, and 24 months after the surgery. Subgroup analysis was used to compare patients who had a preoperative migration percentage of greater than or equal to 50% with those who had a preoperative migration percentage of less than 50%. And to compare the acetabular index between patients who had a pelvic osteotomy and those who had not. Linear mixed models were used to analyze changes in the migration percentage, acetabular index, and CP child scores over time. The preoperative migration percentage negatively correlated with the preoperative CP child score. This relationship continued throughout the follow-up period, such that, for each additional 1% correction in migration percentage, the CP child total score increased by 0.2 point. There was no correlation between the acetabular index and CP child total score before or after surgery. The preoperative CP child total scores differed between the migration percentile groups. However, after hip surgery, The CP child score improved similarly for both groups. Conclusions. These data support the effectiveness of reconstructive hip surgery for the treatment of spastic hip dysplasia to improve the HRQOL of non-ambulatory children with severe cerebral palsy. Thank you for listening to this JBJS podcast. Please visit www.jbjs.org for commentary and perspective on many of the articles presented in this podcast, and for more content of interest.